Well, thank you everybody for coming to identifying our tea and talk sessions for identifying and preventing strokes. Today we have our presenters back, Abby and Brianna, and they're going to be talking about this. But first, I'd like to go over a few housekeeping rules for anyone that's online listening. Just give me one moment. Mute your mic to block any outside noise. Closed captioning bottom is located at the bottom of your screen. Anyone online, put your questions or comments in the chat. Now, questions for Abby and Brianna. Do you want your questions at the end of or during your session?
You can raise your hand.
Yeah, during is fine. During's fine. Okay, this session will be recorded and posted on our seniors website and YouTube channel. Barb, if you're there, can you please read out our land acknowledgements?
Okay, good afternoon. We respectfully acknowledge that the lands on which we live, work, and meet are situated on the traditional territories of the indigenous groups of Newfoundland and Labrador. And we acknowledge with respect the diverse histories and cultures of the Beothuk, Mi'kmaq, Innu, and Inuit of this province. We honor the diverse indigenous peoples who have cared for this land for past generations and for the 7 generations to come. We are committed to listening, learning, and working in collaboration with indigenous communities as we move towards reconciliation, respect, and mutual understanding. Let us carry this acknowledgement forward in our work and relationships as we strive to create a future that respects and embraces the wisdom of older adults and the diversity of all communities.
Thank you very much, Barb.
You're welcome.
So I'm going to hand it over to our presenters today, Abby and Brianna.
Here's this one works. Okay.
And there you go.
Perfect. All right. Hi, everybody. We're back again for the third presentation presented by Neurobridge for the identifying and preventing stroke. So just as a little beginner pre-workshop trivia, we want you guys to answer this question. How many signs of stroke can you name? Yes, go ahead.
Your face,
Okay, yeah,
your arms,
yeah.
speech,
Speech, yeah.
and I can't remember the other one.
And then it's time.
Yeah.
Yes.
Oh, it's time. Yeah.
There you go.
Yeah, you're right.
Well done, guys.
Should've known.
What is the time part? Okay.
So we're gonna go through that. We'll get through it. Okay, another one. Name 3 ways to prevent a stroke.
IST.
Wash your blood pressure.
Yeah.
Don't eat all that old sweet stuff, honey.
Another one? Yeah. Now, treat yourself. I'm a big fan of treating myself.
Exercise.
Yes. Anything else? Yeah.
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 No smoking?
Yeah.
Yeah.
You guys we don't even need to be here. All
I
right.
got a question though.
Yes.
Vaping.
Just as bad as smoking.
Smoking, yeah, so insane. So
Just as bad.
Just as bad.
Yeah. All right. Now, what is a
3
stroke?
that you had in mind?
Sorry?
The previous life, what are the 3 that you had in mind?
We're gonna get into it. That's a little bit of foreshadowing for you. All right. Oh dear. I'm happy. All right. So let's get into it. What is a stroke? So a stroke happens when blood can't get to the brain. So it happens when blood stops going to the brain. To better explain the concept of a stroke, we're going to use an analogy. So I want you to imagine the garden hose in this picture represents the arteries that bring blood from your body to the brain. The water in the hose represents our blood, and the flowers represent our brain. Just like with the garden hose and the flowers, in a healthy body, our arteries help to deliver blood to our brain, which is really important because blood contains oxygen and nutrients that our brains need in order to survive. So in a stroke, something actually happens to the artery itself or within the hose that stops blood from reaching the brain or stops water from reaching the flowers. So that's what happens. That is the mechanism of a stroke. If blood can't reach the brain, then it doesn't get enough oxygen and nutrients, and the cells within the brain actually start to die. Just like if no water comes out of the hose, the flowers in your garden start to die. Does that make sense?
Yes.
Cool. All right. Oh my God, I gotta stop doing that. Okay. 2 main types of stroke. We've got hemorrhagic strokes and ischemic strokes. So a hemorrhagic stroke is caused by an artery that bursts and blood spills out and cannot reach the brain. An ischemic stroke is when a blood clot, so an actual clot within the artery, blocks the blood from moving to the brain. So to help you remember, let's move back to our flower analogy. So remember, a hemorrhagic stroke is when an artery bursts and blood cannot reach the brain. So this is often due to high blood pressure that can cause the weak walls of your arteries to burst. So that high blood pressure that you guys mentioned, that's helping prevention. That high blood pressure can actually cause the artery walls to burst, causing a stroke. We can think of it like there being a leak in our garden hose that stops us from getting water to the flowers that need it.
Artery walls busting, is that an old age arteries, or can that happen to people 35 years of age?
I think it can happen to pretty
It can
much
happen to
anybody.
anyone, but your risk is higher the older you get because you kind of have a bunch of different risk factors that start to build up.
Yeah.
So, for example, you've had high blood pressure your whole life, you might have weaker arteries at 60 than you did at 30.
What's the risk at 93?
Not sure off the top of my dome, but
Yeah. All right. Now, an ischemic stroke is when a blood clot blocks blood from flowing to the brain. So, this could be from a plaque that forms in the arteries of the brain, which causes them to become smaller, or from a blood clot that forms somewhere else in the body and gets stuck in the arteries of the brain. Because you can actually have clots that form in other parts of your body that travel with blood flow and then reach an artery in the brain that's too small for it to pass through, and you get that blood clot and that stop of flow. So, just think of it like there being a clot or a blockage in your garden hose, or when you take your garden hose and you kink it. No water gets through to your flowers. That's the same as an ischemic stroke. Now, there's also something we call a transient ischemic attack. So this is when it's like a mini stroke. So this happens when a blood clot briefly stops blood from getting to the brain, but doesn't permanently block the artery as it does in an ischemic stroke. So this is why it's called transient, meaning brief, mini stroke. That's what we call it. So symptoms of a TIA are similar to a stroke, but should resolve within 24 hours. And most symptoms actually resolve within 1 hour. So even though the symptoms resolve, TIAs are very important because they can be a warning sign for future strokes. Now, that's just like the question we asked you earlier. So the fast mnemonic, like you guys mentioned, how can I tell if somebody is having a stroke? So while we've talked about what a stroke is, it's also important to know how to recognize when somebody may be having a stroke. So a helpful way to remember this, like you guys said, is fast. So F stands for face. You might notice that one side of the person's face is drooping or that their smile looks uneven. So that's a common sign that you'd see. A stands for arms. So you ask the person to raise both their arms. If one arm drifts downward or feels weak and they can't lift it properly, then that can also be a warning sign for a stroke. Yes.
It often or usually the left arm that is, or
No.
could be any arm.
It could be any arm. It would depend on what side of the brain the stroke is on.
And the facial happening,
Mm-hmm.
is that usually the left side as well, or could it be either side?
It could be either side, and strokes work contralaterally, right?
Yeah.
Yeah. So if the stroke happens in the left side of your brain, it controls the right side of your body.
Right.
So your brain kind of is crisscrossed.
Well, above the neck, it controls the same side, doesn't it?
No.
Okay, so the right brain controls the left side of the face as well?
Yeah.
Okay.
So that's why you kind of get that like contralateral
That's what
type.
most people say. Most people do have, well, from what I heard when I speak at the middle say, left, more so than right.
Yes, it is more common
It's
on the
more common.
left, but it does happen on the right.
Oh, yes.
Yes. Does that answer your question?
Yeah.
Perfect. Okay. All right. So S, speech. So their speech might sound slurred or confused. They might have trouble finding words or understanding what you're saying. And then finally, T stands for time. This is the most important part. Time is crucial in a stroke because your brain is actively losing oxygen. It doesn't have that blood that's going to it, giving it the oxygen. So if you notice any of these signs, call 911 right away. You don't want to wait to see if the symptoms go away. You don't want to drive the person yourself unless medical services aren't available because they have what they need to treat the stroke as it's ongoing in the ambulance. So don't drive them yourself. Call 911 as soon as you can. And stroke treatments are time sensitive, and getting help quickly can make a major difference. So again, big takeaway: face, arms, speech, and time. Act fast.
But the face, that doesn't always happen.
No, it's just like when we talked about concussions and dementia. They show up differently in everybody. I wish it was as easy as every patient's going to show up this way. That means they have this, but everybody's different, right? So they may not show the facial drooping, but they may have the arm drooping. You know what I mean?
So
So
I guess it depends on which side you have it,
Mhm.
because if you're paralyzed on the right, that affects your speech.
Yeah.
It depends what part of the brain the stroke
Yeah.
is happening in too. Because it could just affect your motor, so you might just get the arm happening. Or it could be in the part of your brain that has your speech, which then you might just only have speech symptoms. Or it could be a big stroke and you have all three. So if you have any of those symptoms, you want to call 911 to see what they think is going on, or if they think that you need treatment ASAP.
Your brain's like a big puzzle piece, and all the puzzle pieces have a function. So like if you have a puzzle of, say, a cat, and you take out their eye, now they're missing that part that controls the eye. You know what I mean? Like our brain everywhere has a different function. There's sections of the brain, like Brianna mentioned, that control different things. All right. Now, is this video gonna work? Oh,
Press it against.
oh, nice.
Might need the mouse.
So I was doing on TV.
Yeah,
It's the main thing. They don't remember.
Dad, side of your face is drooping. Raise your arms up in the air for me. Why are you slurring? Honey. Call 911. No, he's having a stroke.
Now, am I smart enough to know how to get back into that? Haha. All right. Now, Brianna, take it away. Oh no, that's me. I lied.
All good.
Okay, so although FAST is easy to remember, the acronym has actually been updated to be BFAST to include other ways in which a stroke can present, because like you said, it doesn't show up the same in everybody. So B stands for balance. A stroke can sometimes cause a sudden loss of balance, trouble walking, poor coordination, or dizziness, especially if it feels like the room is spinning or the person suddenly cannot move normally. E stands for eyes. So stroke can also cause sudden vision changes, such as blurred vision, double vision, loss of vision in one or both eyes. And you noticed I said the word sudden many times just then. The key word for strokes is sudden. If any of these symptoms come on suddenly, whether it's balance, vision, facial drooping, arm weakness, or speech difficulty, it could be a stroke or a mini stroke. So if the person you're with, say you're out, you guys have been out for hours and suddenly they become off balance. You've been walking for hours. So this sudden onset of balance issues could be a problem. Whereas if they've been off balance the whole time and that's like their normal state, that might not be a presentation of a stroke. So it's if this person has an acute change. That's what you want to look out for.
Another thing, Rita.
No, go ahead.
Another thing I wanted to add to that, we've been talking about the symptoms and the common ones, but these two, the balance and the eyes, strokes commonly present very differently in women than they do in men. So it's important to remember the balance in the eyes. Sometimes you also get a sudden headache, especially if you're someone that doesn't typically get headaches. That's something to look out for. Nausea and vomiting can also occur. So some of the less traditional signs of strokes typically happen in women more so than men. So I just wanted to point that out there because you might not always have the fast mnemonic as the signs of stroke. So again, anything sudden that comes on, as Abby mentioned, we really want to make sure that you call 911 just to make sure that everything's okay and if they think that you are having a stroke.
The vision impediment that happens, is it just for very short period? Or would it stay on for until it's looked after?
It kind of depends. So if you got treatment really quickly and they were able to restore blood flow to that part of the brain or that nerve, then it would likely come back. But if it was ongoing for a while, then probably not. Because once the damage is done, it's hard to reverse that. Does that answer your question?
Yeah.
Okay.
All right, this is you.
Yeah, this is me.
This is you.
Alrighty, so we've talked a lot about the symptoms of stroke and what a stroke is. So now we'll get into some of the risk factors that increase your chance of having a stroke. And these slides are kind of in order of the highest risk factors, and then they kind of get more milder as we go on. But as you guys mentioned, blood pressure is a major cause of stroke. It's in fact the #1 risk factor. And this is because of a couple of different things. One being that it puts a lot of pressure and stress on your arteries, especially if it's happening for a long period of time, like untreated high blood pressure. So this can cause the artery to either rupture and where you have a hemorrhagic stroke where you're not getting any blood to the brain because it's all going elsewhere, or it can cause minor damage to the arteries over time. And what our body does to repair that is it creates clots or the clotting cascade. And most of the time that does repair the vessel. However, sometimes, as Abby mentioned, the clot can break off and travel to the brain through the blood and then cause a stroke that way. And you'll notice there's a common theme between all of these risk factors in that they damage the arteries and can cause clot formation. So next we have diabetes. So similarly, having high blood sugar, having diabetes, I should say untreated diabetes, where you constantly have high blood sugar, is another risk factor for stroke. And again, this is because constantly having high sugar in your blood can cause plaques to form in those arteries. And then a bit of the plaque can kind of break off and then form a clot, which again can travel up to the brain and block blood flow. It can also cause your arteries to become more narrow once that plaque builds up. And again, the more narrow our arteries are, the harder it is for blood to pass through them. And it also puts more stress on those blood vessels. Next would be smoking. So smoking actually increases your risk of stroke by approximately double. So it's something we really want to look out for. This is for a couple different reasons. When you smoke a cigarette or vape or those types of things, it causes what's called vasoconstriction of our arteries. So it makes them even smaller. So if you already have diabetes, for example, where you already have those narrow blood vessels, it'll make them even smaller and even harder for blood to go through. And it can also, every time you smoke a cigarette, increase your blood pressure and also increase your heart rate, which we also already described as being risk factors. Again, blood pressure being the #1 risk factor. So we really want to try to avoid that. Next, we have high cholesterol. So similar to diabetes, if you have high cholesterol that's not being treated, then it can cause plaques to build up in your arteries. And again, that plaque can crack off and travel through the blood up to the brain, causing a stroke. The next one would be various types of heart disease. One that is commonly mentioned for causing clots is called atrial fibrillation. So this is when your heart beats really, really fast, not in a regular rhythm, and it's too fast for the body to keep up with. And this kind of causes what's called turbulent blood flow within your heart. So imagine you're on the water on a sunny day, there's no wind, and you're just smooth sailing. That's how your blood should normally be in your body. But when you have a day like today or yesterday and it's really windy, you get those waves and everything kind of starts knocking up against each other. That's what happens with atrial fibrillation. Your heart, the blood in your heart kind of starts beating off the walls of your heart, and it can increase your risk of clot. And then where it is within the heart, it can send it straight up to the brain. So that is something that we want to monitor and be careful for.
So is that when you have the pacemaker?
Yeah, so they will typically put a pacemaker in for atrial fibrillation, and that is because it increases your risk for clots so much. Yeah. The next one would be obesity. This one is kind of related to the other risk factors that we mentioned. So typically when someone has obesity, it's been associated with having a higher blood pressure, a higher risk of diabetes, and higher cholesterol levels. So we just want to monitor our weight for those other risk factors as well, just to make sure we're being as healthy as we can. Similarly, a lack of exercise kind of causes a couple different reasons for increasing your risk of stroke. First, you're not exercising the heart as much, and our heart's a muscle. So the more you exercise it, the stronger it is and the better it's able to beat. But when we're not exercising, we're not working out our heart. So that muscle kind of becomes weaker, which is especially important as we age. We need good, healthy hearts to pump our blood all throughout our body. Also, a lack of exercise is typically associated with higher weights. And as we mentioned, that's associated with high blood pressure, cholesterol, and diabetes. So that's also something we want to look out for. The next would be an unhealthy diet. This could be eating too much salt, too much processed foods, too much fats, cholesterol, those types of things.
All the good stuff.
All the good stuff, yeah, stuff we love.
Yeah.
And I wanted to emphasize salt here because when we eat a lot of salt, we start to retain some water or fluid, and that puts extra strain on our hearts because then our hearts have to pump against that, all of that extra pressure. And if you already have high blood pressure, it can definitely increase your risk even more. And I know us Newfoundlanders love our salt, so. The next one would be excess alcohol. So again, chronic use over time can raise our blood pressure and weaken our heart muscles, which again, as we discussed, can increase our risk for stroke. And finally, we have family history and age. Now, these aren't things we can't really do anything about, but they do increase our risk. So if you have a family history of stroke, especially younger in your family, that is a risk factor. And again, once you're over the age of 55, your risk also increases. And this is because some of those other risk factors that we talked about, like hypertension, diabetes, diet, those types of things, they kind of accumulate over time. And once you're over the age of 55, that's when we start to see those impacts of those long-standing processes. Okay. Someone have questions? Okay, just take it.
What about stress?
Yep. It's on either the next slide or slide after.
Okay, thank you.
And I know that last one there, you can't really do much about your family history or your age, but all the rest of the risk factors, those are things that we can manage in our day-to-day lives to help reduce our risk of stroke. So we'll get into that on the next slide. So first would be checking your blood pressure regularly. So this can be getting it checked when you're at your doctor's appointment. If you have a doctor, that can be checking it at home with your own blood pressure monitor. That can be checking it at the pharmacy when you go to pick up your medications. I know some of them have those machines you just put your arm in and then it'll measure it. So that could be easy ways to check your blood pressure at home. And then if you have any concerns, you can bring it to your doctor, 811, a nurse practitioner, whoever you're seeing for your healthcare. Next would be to make sure we're taking our prescribed medications, whether that be for blood pressure, diabetes, cholesterol. Again, just to limit those risk factors, because the lower we get your blood sugar, your cholesterol, the better it is for your heart, your brain, the rest of your body. We also want to make sure we're staying active. And this doesn't mean that you have to run the Tele 10 next month. It can include just walking, stretching that you're able to do, any light exercises, whether that be in the chair, lifting weights, or in the chair doing yoga, or outside of the chair, exercising. All of those are good for our body. And I also wanted to mention here that when we exercise, it actually helps lower our sugars in our blood. So that is kind of dual acting in helping reduce our stroke risk. Next, we want to eat heart-healthy foods. So as I mentioned, we want to limit that salt as much as we like it. We want to make sure we're eating more fruits and vegetables and whole grains, and good lean meat without a lot of fat in it. Next, we want to make sure we're staying hydrated because dehydration can also damage the heart over time. So for seniors, for women, now this does change a bit on your weight, but typically women, it's recommended to have 9 cups a day and men 13 cups a day of water.
Does that include, coffee, tea, juice, soup?
No,
You know what I mean?
I do know
With
what you
your
mean.
water, because that's what I'm doing now. You said, right?
So
Whatever.
yeah, so straight water would be the best. Sometimes coffees and teas have what's called a diuretic in them,
Yes.
which make us pee more. And the more we
Yes.
pee, kind of the more dehydrated we
What
get.
about decaf?
Decaf would definitely be better, yeah.
I think.
But again, the best water is
It's
water.
water.
But of course, get your fluid intake wherever you can throughout the day. So next would be making sure we're getting some good quality sleep. So not sleeping enough at night, less than 7 hours, has been shown to cause minor damage to the heart over time. So we want to make sure that we're having good sleep hygiene. This means staying off screens at least an hour before bed. Maybe instead we read a book, we do a paper crossword, a paper Sudoku. Love my Sudoku. Making sure that we're limiting our interruptions throughout the night. So good. if you're getting up to use the bathroom a lot at night, maybe we stop drinking water after 8 p.m. That could be a way to limit it. And making sure we're having a dark environment that's good for our sleep. So again, we want to aim for 7 to 9 hours a night. Next, we want to manage stress. So this can be a couple of different ways. Chronic stress over time is damaging to the heart because typically it increases your blood pressure, it increases your heart rate, those types of risk factors we discussed. So to manage your stress, you can do honestly whatever is enjoyable and helps lower your stress, whether that be deep breathing, socializing with others, coming to events like these, talking to loved ones, yoga, mindfulness, those types of things are all definitely beneficial to managing your stress. As we mentioned before, you want to make sure you're getting regular checkups, getting our blood pressure checked, getting our cholesterol and our sugars checked, those types of things. Just that if they do start to increase, we catch them early on and not when they've been going on for 10 or more years. And finally, we want to make sure that we're limiting our smoking and our alcohol, because as we mentioned, those are risk factors. And this is something that you can see a physician or another healthcare provider for. For example, if you're having troubles with withdrawals, or if you want to be connected to a support group or something like that to talk to like-minded individuals going through the same thing as you, they can put you in contact with those types of groups. So I want to emphasize some of the key takeaways that we've discussed throughout this and just in general. So stroke is the 5th leading cause of death, and it is a leading cause of disability in the United States and Canada. We've been doing this presentation for about 35 minutes now. In Canada, a stroke happens approximately every 5 minutes. So since we've started this, 7 people have had a stroke in Canada. So it is a big problem in our country. And Newfoundland does have the highest rates of stroke of all provinces. So, really important that we're aware of this.
Any research done on that? Why we are?
We also have the highest rate of diabetes, the highest rate of obesity. So, like we mentioned, those are risk factors for stroke. So you combine all 3, and we've got terrible statistics.
The diet and the exercise as well.
Yeah, and it can be controlled by diet.
Yeah.
But I guess for people, it's easier to pop a pill than change their lifestyle.
Yeah. Especially once you've had the same lifestyle for so long, it's definitely hard to make that change. Yeah, it's definitely hard. We also wanted to emphasize that stroke can happen to anyone at any age, at any time. Which is why it's really important to know those warning signs that we mentioned, or Abby mentioned earlier, the be fast. And this is because the longer that you have a stroke or that you're not getting oxygen to your brain and those nutrients, the more cells that die. So for every minute that you have a stroke that isn't being treated, you have 1.9 million neurons, those are your brain cells, that are dying every minute. And we have a saying in healthcare, which is time is brain. And this is why. So if you do think someone's having a stroke, it's important that you recognize that it's an emergency and that you call 911 immediately so they can assess if it's a stroke. And as Abby mentioned, an ambulance will be able to further assess you and will have the resources to treat that before you're at the hospital.
I knew a man one time, and he's dead now for a year, lovely man, Southern Sherry man, teacher. And he was in an old house of road to collect his rent. He had a lot of houses. And now I don't know what his condition was before. Sweet man, I worked for him. And then he went and couldn't get his rent. He could not get his rent. No way. And he was out, and he had his blood pressure went up so high, so he died. He died in the laneway on Old House Road. And he was, I don't know how old, maybe, I'm not sure, late 50s maybe. Yeah, he died. It's crazy. It does happen. Sorry.
So I like how you said, to reiterate, stroke can happen at any age and at any time. But more so as you get older because of our lifestyles, of our living our lifestyles, damage to our body we've been doing over a long time. But it can happen at any age.
At any age,
I actually had a stroke in utero.
What?
I did.
You had it?
I did. Yep. So they can happen whenever. Like that, they don't know what caused it, but it was probably a lack of oxygen to the brain causing a stroke.
So,
Wow.
but when would that have been? Like,
They don't know, but they know it happened, like based on the MRI scans that I've had, they know that it happened before I was born. So it does happen to children, like Do you know the stats on that with your stroke research?
I know it's less common in children, but
Yeah.
it can still happen.
Yes, a teenager when he was here, when he was playing hockey at the Twin Wings there, he was really young. Doesn't have, but they said,
When you said brain cells die.
Yeah.
Or become, do they literally become dead, or do they just become damaged and they can be resuscitated? Or, and if they die, can new ones be generated in enough amount to
I can
replace
answer
them?
that stroke.
No, no, Lorraine,
Yeah.
no, okay, I'm asking her one per one.
Yeah.
So they'll be damaged first, and then they will die. Our brain can't really, it can repair it to a degree. Kind of if it's on the left side of your brain, the right side can kind of help. But typically, if the cells are gone, you don't typically have the full restore function. And again, the more damage, the less likely you are to have that full restore function. Our brains aren't really like the other cells in our body where they can regenerate quickly.
Like our lungs can regenerate.
Yeah, and like even our blood cells, they regenerate every 3 months. Our brains aren't really like that. It's kind of what you have is what you have. And you do have some cell turnover and some new cells that do form, but not to the degree where it would completely fix all the symptoms. Yeah.
Yeah, well, most of you know.
Just answer, Lorraine.
Yeah, no, most of you know that if I have a friend right now who's had a stroke, past 4 weeks, and is in the hospital. And the neurologist, I was talking to him, and he said that the brains that are damaged, they die, but all around, they rejuvenate.
Yes.
Is that right?
Yeah, so when you have a brain injury, say this is the core. This would be our dead cells. But then you kind of have what's called an infarct. So then you have the cells around them. So these cells, if they're just damaged but not necessarily dead, like these cells, then these can be repaired over time.
That's what he said.
Yeah.
But it takes time.
Yeah.
It's a long journey if you have a stroke.
Yeah.
Absolutely.
You know,
well, some don't live here, because a friend of mine is 63, healthy, single, everything in the world, everything. He's off at the home now in a Littledale home, and like that's his life, he knows everything, he can do nothing. But a week before, or a few days before he had that stroke at his house by himself on the floor for 14 hours, he remembers having a pain down his left arm. He can talk, and he can see you,
Yeah.
and he's 63.
Yeah, that's unfortunate.
Yeah.
Sad, and church.
And again, rehab and physio and those types of things can definitely help because, like I said, they kind of help build those new connections in our brain. So although our brain might not be working here, we can get help from this part of our brain to help mediate that damage.
And as you get older,
He didn't hospital on time, like he didn't, he was on the floor 14 hours because he lived long and didn't have the alert.
Yeah.
So that's why, so they couldn't do it. My husband went, he was smoking a cigarette when he had his stroke.
Yeah.
And he got up to go to the bathroom and his face went down there, he went, and I got the ambulance and they saved him.
Yeah.
But he died of a heart attack later, but he was having his smoke.
They typically suggest if you're having an ischemic stroke, so you have that blood clot in the brain. Typically you want to have treatment within 4.5 hours. That's when it's most effective. We do actually have this new thing here. I think it's since 2024. It's called endovascular thrombectomy. So for certain types of strokes, they can actually go in and remove the blood clot. And that's within 6 hours. So it's a little bit of a wider time frame, but that kind of more depends on some of the risk factors and like if your blood pressure and those types of things. But we are getting new treatments and options and stuff like that. So
So it's also important to note the time that the stroke happened.
absolutely.
yeah.
Because they need to know that
Yeah.
when the ambulance picks them up, and then they also need to know that when they get to the hospital.
Because it can change the type of treatment you get too.
You're getting like, they'll just take you in right away. They're just screaming, taking you in, right? Like
Yeah.
if you have a stroke and you get down right away.
Yeah.
Because I know I was in the front and he was in the back and they were working and they saved me, never died for years after, but a heart attack.
Yeah. When a stroke's coming in on the ambulance, actually, they'll page the stroke team.
Yeah.
It's a bunch of different healthcare professionals. Usually, I'm fairly certain it's a nurse, physician, usually radiology because they like to go and image the brain. And they're pretty speedy with it. They know how important it is to get
Time
the
is
blood flow
brain.
back. Yeah.
Time is brain.
So all of that being said, stroke is an emergency. We want to call 911 as soon as possible. And as we've discussed, earlier treatment improves survival rates, and it lessens the disability. Because again, we're preserving those damaged cells. So make sure that you're calling 911 as soon as possible to tell them what's going on to get the appropriate treatment.
Barb, is nobody online or any questions?
No, there's no questions online at all.
Thank you so much.
Okay.
Okay, so hopefully you've learned a couple things from this that could either help save you or someone else that you know are in the community. And again, now you can be fast and help educate others. So now I think you guys did pretty good with this the first time, but how many signs of a stroke do we know? You can shout them out.
Six.
Slurred speech.
And our time. I
Mm-hmm.
want to make sure we're getting
Be
there
fast.
Yeah.
So relevant.
And what are 3 ways we learn to prevent a stroke?
Lifestyle change.
Big
Money.
Yeah.
Rapid fire.
2 more?
Stress.
Yep. There we go. Alrighty, so thank you for listening. If anyone has any questions or other comments or anything else they want to discuss, we're more than happy to answer
Try and
anything.
The true, if you have a TIA, most likely you will get more.
It definitely increases your risk of having more or having another stroke. Because like I said, or like Abby mentioned, you have already had a blood clot that's blocked something in the brain. So whatever's already there is likely still there.
Okay.
So
We try not to use the word definitely in medicine,
yeah.
which kind of, because like, just because this doesn't mean you're definitely going to get that. Because again, everybody's different. Medicine isn't always completely understood, especially with the brain. We're learning new things every single day about the brain. And my brain isn't the same as yours, isn't the same as hers in the way that it works. You know what I mean? So using definitely in medicine is a tough thing to say, because while you are at an increased risk, you could have a TIA and then not have a stroke. Or you could have a TIA and have a stroke the next day.
You may think now too many eggs are no good for you, because a doctor told not me, friend, stop eating eggs, especially the yolk. So she cut them all out because she didn't want to take 40 milligrams of her blood pressure pill. She wanted to stay under 20. Is that true? It is true, I guess.
I know eggs typically have higher levels of cholesterol, so that may have been why she was told that.
No eggs.
But in general, eggs are good for you.
Yeah, they're good proteins.
That the yolk?
The yolk is good too. The yolk contains healthy cholesterol, healthy fat. But if you have high cholesterol levels, for lifestyle modification, diet modifications, you reduce things that have high cholesterol. Eggs being one of them. But that doesn't mean everybody should cut eggs out of their diet.
Oh, but a lot of people
Yeah.
the age have high cholesterol.
Yeah.
So like really high and high blood, the whole works, and they still eat like 2-3 eggs a day.
Or they'll may eat egg whites.
Yeah, they do eat bagels.
There's the protein in the egg.
Yeah.
We're all different, so maybe we have other factors.
Protein and love.
Yeah.
But you may not know you have the, what is it, what is?
TIA.
TIA.
Yeah, my husband had that one time and he didn't know he had it.
Yeah.
And I didn't know, but one day he was putting on his shoes and his foot wasn't going in the right place. And I said, Fred, what's wrong? I don't know. He said, I've been like that for several days. So we went to the doctor and he said that's what he had, but it had passed.
Yeah.
And he was driving and everything and didn't.
Yeah. They're usually more milder symptoms you get from them.
You can have a silent stroke or a silent heart attack. You don't know anything about it.
Yeah, and that typically be shown up on an MRI.
My husband had that, but he didn't know, so he didn't care. And my niece being a doctor said, you had a heart attack. He said, no, I didn't. She said, you should, it's right there.
Yeah.
So she knew and he didn't, so he didn't really care because he had it in his sleep.
Yeah.
The first.
Well, thank you, Brianna, and thank you,
Abby.
Abby. But just to let you know about information and referral, we're a walk-in service. We do housing, finances, financial,
They're good people.
we'll help you with your financial, elder abuse, daily living, grief and bereavement. Of course, we just had our tax clinics That was a good 2 days. We also have the community outreach. Hello, what we're doing here today. Thank you both. That was a very informative throw.
Thanks for having me.
Thank you.
Extra.
What is Neurobridge?
So we're medical students at MUN. We're in our second year. And it's a combination of a couple different years. Where we go into the community and try to bridge the gap between what we know and what the general community knows.
Because sometimes we get caught up in the medical jargon that we're taught in medical school and the way we talk to other healthcare professionals.
Yes.
And that language doesn't always translate to patients. And the way we speak sometimes confuses patients, which doesn't help with anxiety or understanding their illness. So through this, we're trying to translate very complex topics into understandable material for the broader community so that they are educated. They know how to like approach different symptoms, just so you guys have the knowledge that you need to live healthy.
That's excellent.
You
That's
were
really good.
Yeah.
But the young chap that was with you last time, I was impressed by him as well.
Good.
He's first year too.
And he was
Yeah.
perfect.
Yeah.
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 I got a couple of questions.
He knows how to put on a show.
A lot of people don't understand. You were mentioning about the
Well,
asthma.
Hold on. She
Oh, no, you go ahead. You got a question. Yes.
Yeah, you were mentioning about the eyes.
Mhm.
Can a stroke change? Like the pupil gets smaller?
I do believe so. Yeah.
say so.
Because that'd be the nerve.
Yeah, I think if it affects the nerve.
One day at the hospital, the nurse said to me, his pupils are awfully small. I said, I haven't looked into his eyes for a long time now.
Some people also do just have generally small
Are
pupils.
very tiny, and I don't know. So could they?
There's a lot of different things that could cause small pupils. You'd need like a further evaluation, I feel like, to know if it was a stroke.
They could have done something with his eyes because they're not long ago, I had my eyes tested for cataracts, and my daughter said, I gave her a picture, and she said, Mom, are you on drugs? And I said, no, not yet. She said, and she sent it there 4 days, said, what's wrong with your mother? Because they had to put drops in, and they're just.
Different medications to do it.
Changed.
Exactly.
Dilation drops.
Yeah, dilation drugs.
So just to continue on, we have social prescribing and link workers. Well, you hear about our social prescribing, our link workers here at Seniors NL, where they're like a branch of Seniors NL. They work with family care teams across the city. We have two at east, one at west, and we have them all over Newfoundland. So what they do, they help clients with non-medical forms and anything else that they need help with. So they're a really good branch of Seniors NL. They're like our extension.
Can you contact them through here, Sharon?
You contact them through here, yeah, and we can direct you to the current link worker. And of course, you can always contact us, info at seniorsnl.ca, 1-800-563-5599. And of course, on our website, www.seniorsnl.ca. And on that website, you can click on our current events. You can click on if you want to become a volunteer. Check our website out. They have a lot of features on it. We've just upgraded our website and it's really good. And of course, follow us on Facebook and Instagram. Thank you for coming.